Okay, so I know some of you aren't super comfortable with the Play-Doh, and I just want to go through and give a second way to actually explain the different cuts of the kidney. So we'll start with just our anterior posterior approach, which is going to be this one right here. So if we're looking at this, we're just going to imagine that this is going to be the right kidney, because again, we're going to pretend like this is going to be the patient's right over on this side. So if we're going in, this is going to be our lateral cut, this first dotted line. So this is what we're going to typically see in our first lateral cut. Again, this is going to be all cortex for the most part, and then a little bit of sinus to absolutely no sinus should be in this cut. Now, if you think about the sinus lies in the inside of the kidney, essentially. So the cortex lies all along the outside. So if you start cutting in thin little slices, you're going to have mostly cortex to begin with until you get to that sinus part, wherever it is. So again, you may see just cortex, or you may see a little bit of sinus. And again, this is coming from an anterior to posterior approach. Now, if we do the mid, what we want to do is we want to get that longest access. So you don't want to get anything that goes from like here to here or here to here. You want to get a nice straight long access of the kidney, and you can do that just simply by tweaking your probe a little bit. And when you get that long access of the kidney in sagittal, what you're going to have is essentially an image that looks very much like this. So again, on that outside, we're gonna have the cortex, and again, it should be at least 1 centimeter thick in normal patients. If it's a little thinner, that usually is an indicator of some sort of renal function issue. So, and then again, we're gonna have a nice bright echogenic center right here where the sinus is gonna be. In there you might see little echogenic walls to vessels, vessel walls, whatnot. But again, you're gonna have a nice long axis. Now, when you have this nice long axis, again, I keep talking about measurements, you're gonna measure from the superior end to the inferior end when you're going through and measuring. So it's very, very important to go through and make sure that you have that mid cut right along that middle portion of the kidney at its longest axis. And again, we're gonna go through and just make sure we have the nice accurate length on that. And now the medial cut. Now when we talk about the medial cut, that's medial to not only the organ but the body. The reason that the cut's gonna look a little different is, again, we have our hilum right here that enters right around the medial aspect. So what you're gonna typically see is an image like this. And again, you're gonna have a nice break in your cortex. You may see some sinus in here, which I did not draw, but I drew the vessels coming in and out of that hilum. Now again, this is an anterior to posterior approach. You should still be seeing those vessels. They might not be quite as clear because, again, we're coming from anterior to posterior, and those vessels travel from lateral to medial, but you will see some sort of vessel activity coming in that break in the cortex. So again, usually with it, I'm gonna do it in blue, you'll have a little bit of sinus through here, the vessels coming in and out of the hilum, and then a nice long portion of that kidney with, again, this little break right here in the actual hilum. So go through one more time. Lateral aspect, very minimal to no sinus. And again, that's because we're gonna be just cutting that very outside portion of the kidney. Then when we have our mid portion, you're gonna have a nice big amount of sinus, a nice elongated oval shaped kidney. If you're seeing it where it tapers off and pinches at one end, chances are that you're off to an oblique angle. So you want to do your best to try to round it. Some people's kidneys are just shaped like that, but for the most part, if you're going through and tapering off quickly, you might be at an oblique angle. And again, you want to just tweak your probe a little bit and get it nice and elongated to where it looks like this. And again, good amount of sinus in the middle, and you will see some vessels. And then we get to that medial portion in sagittal from an anterior to posterior approach. You will have it where there's going to be a break in that cortex, as you can see right there, and that is because the vessels are going to be entering in and out of the hilum at that point. Now we're going to move to the transverse cut of the kidney. With this coronal versus anterior to posterior approach, they're going to be very similar because we're cutting from up to down, regardless on whether or not we're coming from the front or from the side. We're taking superior to inferior cuts. So your positioning, the only thing that'll really matter is where the hilum will be on the screen, which is kind of not really relevant at this point. I just want you guys to understand the cuts. So again, if we take that first superior cut, the superior cut, we're gonna just go over and we'll see just, again, a very, very good chunk of cortex. It's usually gonna be a little bit rounder. You may see a very small amount of cortex in it, but our goal is to just get that nice, nice top superior portion of the kidney in a transverse round cut. Then if we move inferiorly to our second superior cut, what you will see is, again, same thing, very, very similar. It's gonna be a little bit bigger than our first cut, and you're gonna have a little bit more sinus coming in. Again, typically here we don't want any sinus. Here we wanna start seeing sinus come in. The sinus won't be off to the sides, it'll be right in the middle. So it'll just have a little bit of an echogenic sinus here, and then it'll be more of that hypoechoic cortex surrounding it in a nice full circle. Now, when we do our mid-cut, we want to get a nice C shape. So again, that's how you can kind of tell if you are in that perfect transverse mid-cut versus an oblique attempted mid-cut. So again, we can see right here along that mid-cut, we're going to cut right down the middle of the kidney, and we're going to get into the hilum a little bit, which is going to create that C shape. So again, this is going to be the same no matter what you're, where you're coming from. You're going to see that break in the kidney. You will see the actual vessels on the medial side of the screen, whatever that is. So if you're coming from the right, you're going to see the actual hilum of the vessel. If you're coming from coronal, you'll see the vessel at the bottom of the screen. Whereas if you're coming from anterior to posterior, you're going to start seeing them come towards the side of the screen. So again, your approach, the only thing it's going to do is just take this and essentially rotate it, but that cut should still be the same. It should still be a nice pretty C shape with the break in the cortex for the hilum for the vessels to come in and out of. And then again, you'll have a little bit of sinus throughout here that I didn't draw. And then our two inferior cuts are going to be very, very similar to our superior cuts, as you can see. So we have our superior inferior cut and our inferior and inferior cut, and our inferior inferior cut looks like our superior superior cut. And again, that's just because we're at the very, very outskirts. So we're just taking a nice little layer that typically the sinus won't start until, again, if we would draw the sinus would go through like this around the kidney. So typically what we want to do is we haven't gotten into that sinus yet, whereas this one we're definitely in the sinus portion. So you're going to have that nice little cross cut of the sinus, and it might be a little more than this, it might look more like this, it might take up a good portion, but you're going to want to see that nice ring of cortex around the sinus either way. And then again, same thing, our most inferior of our inferior cuts should be completely out of the sinus. Again, some people's sinuses will go through and come very, very close to the periphery area of the kidney when we're doing the cuts. That's okay, but you definitely want to show differentiation between our inferior and our superior inferior cuts. So again, when we talk about our transverse cuts, our superior superior and our inferior inferior cut are going to be very similar, and they should not have any sinus or very, very minimal sinus in them. And then our inferior superior cut and our superior inferior cut, again, should both be nice and round and have a little bit of sinus in the center of them, but you want to make sure that, again, it's round and not in a C shape like we're going to have with our mid cut, not where it's like a very big oval. If you're at an oval, you're probably coming in at like a weird angle versus this kind of like an off-kiltered. So again, we're imagining making that straight line. If you come in at an angle that is slightly like this, you're going to have a very oblique cut, and it's actually going to be more of an ovoid shape versus a round shape that you're going to have. And then finally, our mid-cut, which is going to go right along the most midpoint. You're going to have a nice pretty C shape. You're going to have a nice break in the cortex. If you're getting something that looks like an off-centered C, or let's say you're getting something that looks like this, chances are that you're at like a very awkward oblique cut, and all you need to do at that point, you're probably at a good spot. You're just going to want to slowly rotate your probe until you get a nice good transverse cross-sectional C shape. And then when we do measurements on our C shape kidney, what we're going to do is go from the hilum in the middle and then our anterior to posterior cut, because again, remember, we're scanning anterior to posterior, or again, if we're doing this, it would be it would still be it would be lateral to medial, anterior to posterior. So again, when we're going through, we want to get this nice and rounded because we're doing the anterior to posterior cuts. And if you're not coming from anterior to posterior, it's going to be essentially medial lateral cuts with that as well. So finally, we're going to move to the coronal cut, and this one's a little harder for me to discuss just because I have a 2D board. But what we're going to do is we're going to take cuts from forward to back. So essentially what we're going to do, and just think about the way that these kidneys lie. They're not 2D, so they're going to have a little more cortex in the front and a little more cortex in the back, and the sinus is going to basically be entirely in the middle. So with this, what you'll see are different shapes, because again, we're going and slicing along. Instead of slicing from forward to back, we're basically coming in and doing a nice side cut of everything. So our first little thin side cut, and again, it's going to be the lateral versus medial portion, and the medial is the concave aspect of the kidney because that's where the vessels start coming in. Not in the lateral aspect, they're definitely gonna be more in the mid aspect of it. But when we get this, again, we're gonna typically see mostly cortex. You may see a little bit of sinus. So it looks very similar to our lateral aspect that we talked about over here. However, the shape is gonna be a little bit different. And again, that's because we're going essentially from here to here versus front to back. We're going from the lateral to medial aspect of the kidney instead. So we're just gonna have a nice little shaving, nice little slice. And again, you will mostly see cortex because the cortex is on the outside and the sinus is going to be in the internal part of the kidney. But you may see a little bit of sinus in there. It may not be much, but you may see a little portion of the sinus throughout the kidney. So just do a little bit in here. Now, when we go to our mid aspect, it's going to be the same thing because again, we're going from lateral to medial. So again, our medial aspect's not going to change. It's just going to be our anterior to posterior cuts that change. So when we start getting, you're going to see a lot more of that kidney shape. You're going to have it much more, and I could have probably done this a little bit clearer. But what you'll basically have is going to look very similar to this. And again, we're going to have those breaks, and you'll have a lot more sinus throughout here. So again, what you're gonna have is this, and again, it's gonna look just like this kidney is right here because I drew it out in essentially a 2D aspect. So it's gonna look very similar. So if you take this and you draw this, or you visualize this with this being the lateral and this being the medial side, it's gonna be the same thing here. But again, it's just the view is gonna be different on our screen. So if you take this kidney and you rotate it, you'll essentially get that same cut here. Again, when we go through, we do our measurements from superior to inferior. And then our last little portion, it's gonna be our posterior cut. So with this, again, we're going from medial to lateral, and then we have to physically angle our probe forward towards the back. So again, we go forward and then we sweep backwards if we're going in a coronal cut, whereas an anterior posterior approach, we would have to physically move from lateral to medial. So again, this is gonna be our posterior cut. Same thing, we're gonna have a little bit of a concaved edge right here, and again, that just shows that we're in the medial aspect because of, again, this is how our kidneys are shaped. So again, we're gonna be coming from lateral and medial. You may see a little bit of sinus, you may see a little bit of a break in the kidney, but for the most part, what you're gonna see is going to be cortex, and that's because of the direction that we're coming in at. We're not getting big cuts of the sinus. You're gonna see a good portion of the sinus here, but again, you may see next to no sinus, or you may see a very little portion of the sinus here. So again, last time, anterior portion, and again, the posterior and the anterior aspect may look very similar. Just try to get 3 different cuts elongated showing the anterior to posterior aspects. So when we're looking at the screen, again, we're gonna come from lateral to medial, and since we're in sagittal, are not just gonna be at the patient's head or superior, and the other side of the probe will be inferior at the patient's feet. And again, you'll see just a little bit of a front slice of this kidney. So if we were to imagine this kidney as a 3D object versus a 2D object and build it on itself, we would just get a nice little slice. And again, usually the sinus is internal, so if we're getting a nice little superficial slice of it, you're not gonna see any sinus. And then our longest coronal cut, you're gonna see the break in the hilum, you're gonna see our little vessels coming in and out. You're going to see a good amount of sinus, and again, you might see even more than this, and that's okay because typically this is going to measure, the cortex will measure 1 centimeter or more in normal patients. So this is actually a very thick cortex for all purposes. So again, you'll see a lot more sinus throughout this, and then the break of the hilum. So that's the big thing, is like the break of the hilum is going to be in the medial aspect. And then our our posterior aspect is going to look very similar to our anterior aspect. Again, you may or may not see the vessels coming in here. You might see them on both. You might see just them in the mid cut. Just depends on how far you sweep forward and backward. So again, if we're at that posterior cut, just imagine the kidney as a whole. You're not going to see a lot of that sinus inside. You won't see a good amount of the vessels, the breaks. What you'll just start to get is like a bean shape, essentially. So here we go. One last little overview. Anterior to posterior lateral, anterior to posterior mid, anterior to posterior medial. Transverse, does not matter the approach, anterior to posterior. The only thing that's going to change is where your hilum is at on the screen. So whether or not you're coming from coronal or anterior, these are how your cuts are going to look. So superior, superior, mid, inferior, inferior. And again, the only thing that's going to change is where your hilum is actually at on the screen. And then our coronal cut, which is very hard to show you, we'll have our anterior cut that's going to be very comparable to our posterior cut, and then our mid cut, which will show that nice break in the hilum, and it'll be at our longest axis of the kidney, whichever kidney it is. And it doesn't matter with this, whichever, right now I'm not determining which kidney I'm scanning, because no matter what, your hilum is going to be towards the medial aspect. So whether or not this is the left or the right kidney, really you cannot tell unless you look at surrounding vessels, i.e. like the liver. Since I don't have anything in here, we can just assume it's the left kidney, but even the left kidney you will see in the superior aspect, the spleen. If this is the right kidney, you would see the actual liver. But again, the hilum is going to stay at the bottom of the screen unless somebody has a hilum in a completely different spot for whatever reason. We're going from lateral to medial, and that's where the hilum of the kidney exists, because they have to travel towards the aorta and IVC, which lie medial in the body. So I hope this helps.